Alright, so finally we've dissected all of the hairs into individual follicular units, and our patient is still numb from before. Did a little bit of additional numbing just to make sure he's not going to feel anything when we're actually putting the hairs in, but if you come over here and look right up here, we've got some piles of hair grafts here, and you know, this is basically you know, individual follicular units of grafts, and some of them have single hairs, some have 2 hairs, some have 3 hairs in them. Each pile is about 100 hair grafts, and then we've got another thing over here with more grafts. So we are ready to start placing the hairs in. So we're going to come over here, and as you guys saw before that we're watching, we made all of these slits prior to you know, dissecting all the hair grafts down. So we made about 815 slits towards the front of the hairline here, and the rest of them are within the frontal forelock, and they're within the crown region. Right now, we usually start by placing the hairs along the hairline first, and these are the single hair grafts for the most part, and we put the 2s and the 3s behind that, so it's called a microfollicular transition zone, and it looks more natural that way. So we've done additional anesthetic, and you can see there's pretty much no bleeding coming from any of the sites that we're putting the hairs in right now, and it's just a one-by-one process of sliding the hairs in very gently with this micro forceps. We don't want to crush the bulb or the follicle, or it won't grow that way. So this is just the planning process. We're going to transplant all 815 grafts along the front of the hairline here, and then we're going to transplant a few more you know, behind that in the frontal forelock, and even a little bit further back into the crown. And it's really you know, pretty clean process. It's just sticking hairs into tiny little slits. So it's really not so invasive.
And are you guys hoping that the hair will then start to grow on its own to take?
Yeah, so basically the hair has 2 parts to it. It has the hair shaft and the hair bulb, and after about a week, this hair shaft that you see sticking out there, that actually just dries off and falls off, but the bulb stays underneath the scalp, and then in 3 months that bulb actually will grow new hair. So after a week, you could look at this area and it doesn't look like very much was done at all. It looks like you know, paid all this money and nothing happened, but in 3 months that's when it starts to grow.
If you guys have any questions, you could ask the doctor about hair loss, hair transplants. We do edges restorations. Does this procedure hurt?
He's not feeling anything. Are you feeling anything there?
No, I'm fine.
No pain or anything?
No.
Okay. So he's awake. He's a little sedated, but he's awake and able to answer questions, and he's not feeling anything because we're not actually making any cuts right now. We're just sliding into these open little slits. So there's really no cutting of the skin right now.
Do topical solutions ever help with growth?
Well, in terms of doing hair transplant, we sometimes will add something called PRP to the transplant, and that can actually help with the growth, but the results are good with or without it, so it's becoming more popular, and sometimes that can be used in addition to or instead of doing a transplant. It's just not as good. But in terms of topical solutions, I recommend Rogaine for patients to maintain the hair that they have. It's really important to be on something like that, but a lot of the other topical products, it's hard to know whether they really work or not.
Can you ever use other people's hair to transplant into your own?
Not really. There were some cases done probably over a decade ago where there was someone who donated bone marrow to someone, and they also donated some of their hair, and that did actually work. But it's just like any transplant, whether you do a liver transplant or, you know, a kidney transplant, the person that receives someone else's transplant has to be on medication the rest of their life, so it's really not worth it for hair to be on dangerous medications like that. that affect your immune system. So for the most part, the answer is no. You cannot get hair from someone else unless you had, the unfortunate circumstance of needing a bone marrow transplant from someone, and they also wanted to give you their hair.
And somebody was asking if you have to then use Rogaine for the rest of your life?
Rogaine is a very popular product. I mean, we don't sell it here, but patients that take Rogaine tend to not lose their hair as fast, or maybe not even lose it at all sometimes, but more often it just doesn't get lost as fast. And if you stop using Rogaine, then you would lose more hair. That's very common. It has nothing to do with this transplant, though. We're just talking about male pattern baldness in general. These transplanted hairs wouldn't be lost because they're coming from an area where, in the back of the head, where he would never have lost them. So these won't be lost, but he could lose additional hair in areas behind where we're transplanting, and then he would have to come in for another transplant, which is fine. You can have more than one transplant.
And can you talk a little bit about edges restoration? Is this a popular procedure here?
So edges is something that's been around for a while. It's something, I think the name itself has become more popular over the last year or so, but it's something that I've done a lot of. We just didn't call it edges before. And a lot of women who have worn braids or have done any kind of rubber banding or anything along the front of the hairline, and especially on the sides, have lost some of that hair. And if it gets pulled out, sometimes it grows back and sometimes it doesn't, so it tends to thin the more braiding and the more traction it has. So in order to restore the edges, we basically do a very similar process to what we're doing now with transplanting the hair. It's just more in areas where it's thin instead of areas of total loss like this. So this is a one-by-one process. It's not like the old plugs when people used to put in 10, 20, 30 hairs in one spot. These are individual follicular units that are going in, and we expect a very natural result with this.
And will this last for the rest of his life?
Well, that's the idea. These hairs are coming from an area where he would never have lost them, in the back of his head. And if he was going to maintain that hair for the rest of his life, then I could put that hair anywhere on his scalp and it would grow like it did in the back, and that's called donor dominance. So these hairs, they usually do not get lost for any reason.
And does it ever not take?
We haven't had that experience here where it didn't take, but I have read about it. But we have not had an experience where a hair transplant simply didn't work. But it is certainly one of the risks, and it's something that we've all read about.
And how long does this procedure typically take? I mean, I think maybe some people think you've been doing this since the earlier broadcast, but there was a little bit of a...
Oh, sure. Well, we started earlier where we took the hair from the back of the head, and then there was a period of time where our patient here was just, relaxing while we were just trimming the hairs under a microscope, which we had showed before. And, for those of you tuning in, I think some of the videos are still there. You can go back and watch those to see what happened earlier. And then there was a period of time where we made some slits here for the hairs to go in, and then now we're putting the hairs in. So we've only actually been touching our patient here for about 45 minutes so far. It only took about 15 or 20 minutes to take the hair out of the back of the head, and then somewhere, I don't know the exact timing, but about 20 minutes to actually make the slits. So we haven't even been touching our patient for 1 hour now. A lot of it was done in the microscope area. So the total time for the procedure of actually touching the patient is going to be a little over 2 hours, most likely.
And what about somebody who's completely bald? Would they require multiple hair transplants, and where would the donor site be?
Well, it depends on how much hair loss there is. If you don't have any hair to donate, then the procedure can't be done. But if you're just totally bald on top of your head, but you have plenty of hair in the back and on the sides, then we can harvest from that area in the back and from the sides. And depending on what your density is, we can do over 3,000 hair grafts in one day. It's me and a whole team of people that do that here at Lexington Plastic Surgeons, and certainly over 3,000 grafts is possible. It just depends on the density, and it depends on how much hair the person needs. So there's a lot of factors that are involved with it. Certainly we can do a lot bigger of a transplant than this.
And do you also do eyebrows and eyelashes?
Sure, we do eyebrows, eyelashes, facial hair, mustaches, beards, goatees, any facial hair or scalp hair we can transplant.
And how much does a procedure like this typically cost, or a range?
So something like this along the hairline qualifies for our minimum pricing, which our pricing starts at $5,500. That includes everything. There's no other fees involved. And certainly there are cheaper places, but there's also more expensive places, and we're very proud of having a fully accredited surgical center where we're doing this procedure right now, and most of the places, even in Manhattan, aren't even accredited. So we're very proud of our accreditation where we're doing this, and we're doing this in a monitored setting. A lot of places don't use monitoring, so it's a very safe environment to be having a procedure, and we find that that price is very fair. Certainly a bigger procedure would be a little bit more money.
And somebody was asking about the incisions you made earlier, and that's to prep the skin now for...
Sure, so basically it's a little bit more than just poking holes. There's a lot of artistry that went into creating all of these slits, and there's density that we have to be cognizant of, and the direction of the hair and the angle of the hair, and not making every single hair in the same direction, because that wouldn't look natural either. So there's like I said, there's a little bit of artistry, or a lot of artistry, that goes into this, and you create the slits the right depth, the right size, the right angle, a lot of different things that I'm factoring in when I'm actually making those slits. And then once they're created, now we're gently putting the hairs into those slits.
What are the risks, if any?
Yeah, so we went over that in the last video, but just in general, there is a risk of having bleeding, although that hasn't happened. There's a risk of infection, which I haven't seen that before, but I've read about it. We discussed a few minutes ago that there's a risk that the hair transplant wouldn't work, but haven't seen that either. Certainly there could be scars. If it's done right, typically the scars are imperceptible. You can have shock hair loss. That's why earlier I was explaining that we use something called Kenalog to prevent anyone from having their hair go into shock. But in general, it's a very non-invasive procedure. It's very superficial, so there's really not much that can go wrong with this.
And somebody asked if she wanted just to get her peak done. Would you guys do that? Just the widow's peak, I guess?
We do, yes. We reshape hairlines, whether it's widow's peak or filling in the corners. Certainly all of that can be done. There's a lot of patients that come in just to reshape their hairline, whether it's a widow's peak or something else. If you check out the information about me on the web, you'll see that I've written a lot about the hairline, and certainly I'm very popular for hairline procedures.
How about washing their hair? How long will the patient have to wait before they could wash their hair?
So they've done mechanical strength studies where they try to pull out transplanted hair, and after the 4th day it actually takes the same strength to pull out a transplanted hair than it takes to pull out the regular hair. And so we have our patients just use a spray bottle for the first 4 days, and then on the 4th day we actually allow them to shampoo with baby shampoo.
And somebody asked about the website. You could visit LexingtonPlasticSurgeons.com, but Dr. Ende also has his own website.
It's called HairRestorationOfNewYork.com. There's a lot of before and after pictures on HairRestorationOfNewYork.com. In fact, I think there's hundreds of photos before and after, probably more than really any doctor in New York. So certainly you can see some good examples of the work there.
Yep, we're based in New York City. Do you see what's the ratio of men to women that come for hair restoration?
Well, it depends on what type of hair restoration. Certainly facial hair transplants are all men, but hairlines is a good mix of men and women. That changes by the month, by the year, so I don't think you can really put your finger on an exact number, but I do men and women. Basically, whoever needs the work done, we do.
And what type of anesthesia is being used, or?
So our patient received some oral sedation earlier today. That's just some pills, and he got an additional dose recently. And then we also gave some local anesthesia with a needle, like going to a dentist, and that's all he's received. He hasn't received any gases or any IV medications, and he hasn't really been feeling anything at all. He's been resting comfortably here.
So the start to finish from when the patient came in this morning to when he gets to go home, what's the total time?
Well, he came in and we got him ready for the procedure, and the pills that we gave him took about 20 to 25 minutes to fully kick in. We started, what time did we start today? We started around
9:30, 10?
About 9:30, 10 o'clock, something like that. We got him in the room, but we didn't actually start the procedure probably till just a little bit after 10, I think. And I anticipate that it's going to take us probably an hour and a half more to put these hairs in, perhaps maybe an hour and 45 minutes. So we're looking at, he's going to be here with us for about 6-7 hours basically. Certainly if it was a bigger procedure, we would have more team members here, and so we can still do the procedure in a shorter period of time. But for a procedure like this, he's just basically relaxing here while we work on him. The only time we actually touched him, though, is probably about 2.5 hours of that time. The rest of it is just under a microscope. So a lot of the time he's spent just hanging out here, playing with his phone.
Mm-hmm.
So you can see it's just a one-by-one process of, grasping the hairs, and every once in a while we're spraying the hairs down to keep them moist, and the ones that we haven't transplanted yet are on ice right now to keep them cold. And we put single hairs across the front of the hairline, and the 2s and the 3s and some singles behind that, creating a transition zone just to keep it looking natural.
And like you said, the final result, you really typically wait a year.
Yeah, we take our final pictures after a year. Most of the pictures on the websites are after about a year or so. That's when you see the final result.
And is there a limit to how much hair you can transplant?
It depends on your amount that you can donate. It's some people could only donate about 5,000 hairs. Some people can donate up to 10,000 hairs. The idea is that we don't want the back to start looking thin if you've taken too much hair from the back. So it really depends on the patient. But in general, most people that are having hair restoration could donate anywhere from 5,000 to 10,000 hair grafts.
So somebody asked what's on the glove right now.
Each of those, that's like a little pile of hair grafts, and we don't put all the hair grafts on the glove because we don't want them to dry out. So we just put a small pile of hair grafts on the glove, and some of them have single hairs, some have 2 hairs, some have 3 hairs. But those are basically follicular unit hair grafts. The hairs actually have a little bit of fat attached to them. That's the yellow stuff. And then the white stuff is some fibrous tissue, and then the black shafts and bulbs that you see, those are the hairs.
Does this make your forehead smaller?
Well, we basically moving the hairline to a different place. So if you're measuring the forehead from the area between the eyebrows to where the hairline starts, then yes, it does make the forehead smaller. But he used to have hair in this location, so we're just restoring the hair back to where it was.
And how do you know which slits still need to be filled in? Is it working in a row, or?
Just by looking at it, we basically filling in every slit that I made, and we're keeping it as dry as possible. You can see there's not a lot of bleeding there, so we're able to see each individual slit. It, maybe on the video it doesn't look that clear, but here, as we're looking at it, it have 2.5x magnification on glasses, so I'm able to see each individual slit and put the hairs into those slits. So each of those slits will get filled with a hair graft, whether it's 1, 2, or 3 hairs. So we're gonna, video for another minute or so. It's just a lot more of the same, but it'll take us another hour or so to put the rest of these hairs in. So if anybody has any more questions, we can answer those in the next minute or so.
Yeah, my camera went weird.
The cost we've went over several times, so just take a look at the old video and you'll see how the cost structure works.
And if you guys want more information about this procedure, you can visit our website, lexingtonplasticsurgeons.com. We have a section on hair restoration and the different procedures that Dr. Ende does, including hairline lowering, hair transplant, edges restoration, follicular unit extractions.
We basically do all of the different kinds of hair restoration that you can think of, and if anybody is interested in this procedure, we do offer free consultations here at Lexington Plastic Surgeons. So you're welcome to call us and come on in for a consultation.
Does it last forever?
The theory is called donor dominance, and we're taking hair from an area that he would never have lost it and putting it into an area where he did lose it, and that hair will live in the front as if it was in the back. So he should maintain these transplants lifelong. He could, however, continue to lose some of the other hair around it, behind it, and then he would need another transplant again for those areas. And a lot of people actually asked earlier if our patient gave consent to be on this video, and the answer is absolutely yes. We would never put anybody on video who didn't want to be on video, and he signed paperwork allowing us to do this, and he's actually awake right now, so if at any time he wanted me to turn the video off, we would do that, but he's pretty excited to be on video and having everybody watching. Making sure we're doing this right, of course, so all of your eyes are on him. But we're pretty comfortable doing this procedure now, so we don't mind getting taped live. We're not, having everyone watch live. Everything went very well today for him. We expect some really great results.
Yes, we do. Dr. Ende does do eyebrow transplants as well, and eyelashes.
Alright guys, well I hope you enjoyed this surgery. We'll try to bring some more surgeries to you in the future. as long as the patients agree to it. Not every patient wants to be broadcast on Periscope, but everything worked out very well today with this broadcast, so I'm sure we'll be doing this again soon. Hopefully we'll bring you some hairline patients getting a hairline lowering and some follicular unit extraction patients. We do basically every type of hair restoration, so I'd love to be able to share examples of all those types of surgery with you.
Thanks everybody. Tune in next time.